in the last couple of years, there's a lot of digital presences came into picture after the COVID came in. So digital communication and telepresence, in simple terms, the category includes any smartphone or internet connected computers. This came into a lot of effective communication mode for the patient with the doctors. Telephone, telehealth, telemedicine, telehospitals. These are the buzzwords came out after the COVID came in. It is not that this technology was not present before, but it was the real action came in only after the COVID came in. The digital technologies have aided the transition from paper-based electronic health records and allowed for a richer, more data-dependent ways of leveraging interconnect of health records. That's what happened during the COVID time. Then there are some changes coming in. Semi-autonomous service robots are came in picture, where the patients are COVID positive patients, where doctors then need to directly interact with the patients. There are a lot of teleconsultation done through service robots. There are medicine got delivered through service robots. This is the second thing. Third thing is artificial intelligence came in a big way. A lot of algorithms came into effect during the COVID period. Rather than following a predetermined or detailed direction provided by the programmers, one particular form of AI machine learning allows technology to develop its own rules and response once trained in existing areas. So artificial intelligence played a big role during the COVID period.
Yes, earlier, mainly the patient coming to the hospital, doctor treating their OPD if they are feeling the admission is required or some other investigations are required, then they are prescribing and the patient doing those things then and there or some other location and coming back for the follow-up. So that way things were going on since past. But post-COVID, patient don't want to even until unless it is mandatory, don't want to come to the hospital. They want to have the things from their home. So home care, luckily we started in 2009, beginning of 2019. So and somehow in end of the 19 it's got matured, and when then pandemic came, so our home care served lot of patient at their home, and patients are very happy because they not traveled to the hospital and they are they are intact from the infection of the other patient or in contact of like transport and all in that manner. So the virtual consultation, automation, those things come in the treatment of the patient, and it's very well adopted by the patient, by the doctor, by the nurses, everyone, and management also supporting on that part, because management also plays very important role in all these things. So virtualization, it is a key for the healthcare as well as other business organization as well.
During COVID, we were at the forefront, and we actually went through the pain of the fact that we had to turn away patients because we did not have beds in the hospital, and that's never an easy decision for a healthcare provider. If you look at statistics, I think India has around 5 beds per 10,000 people, which is quite less compared to Japan, which is 130 or so, and US is, I think, 80 or 60 or something of that sort. So the number of beds per 1,000 or 10,000 people is extremely low in India. When we look at trying to solve that with either using process or technology, you need to either increase the number of beds or you need to reduce the number of hospital days, which means the number of days a patient stays in the hospital. That again can be done through technology, making sure that you have right systems, processes, administration of machines, medicines digitally, and so on. Or you need to look at providing remote healthcare, which means you take healthcare to the patient's home. Then you're not worried about beds, right? So in many of the, in our case during COVID, we had a number of IT solutions that were geared towards providing healthcare solutions at patients' homes. So either it is as simple as teleconsultation, where they call you and say that I have been tested positive, and then you treat them over the phone if it is not very symptomatic. To the other extreme where we are setting up a home ICU for these patients with equipments and devices at their home. They are connected to the devices. The devices are streaming medical information to the cloud, comes on a central monitoring system. We can view it from here and the doctors can intervene and treat sitting here. So that is, from my perspective, I see the push for remote healthcare as something which would help address this situation. Because then you are using technology to solve a problem by using patients and treating patients at their home rather than having to increase the number of beds in total.
For more updates from CXO TV, please like and subscribe to our channel.